Before we start the agenda, I'm going to confirm member access. I'm Dawn Holgate, Chair of the Nantucket Select Board. I'm going to go through the members present. First, Christy Ferrantella.
Here.
Jason Bridges.
Here.
Matt Fee.
Here.
It looks like Melissa hasn't joined us quite yet. Next, I'll go through town staff members. Erica Mooney.
Present.
Tucker Holland.
Present.
Libby Gibson.
Here.
Janet Schulte.
Here.
Jericho Mealy.
Present.
Brian Turbot.
Here.
David Gray.
Here.
Holly Backus.
Present.
Jeff Carlson. Jeff Carlson. Mark Willett.
Here.
And we have Gary Shaw from the hospital with us this evening.
I'm here. Thank you.
We are using Zoom webinars for a meeting which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise the hand button if they wish to speak. The chair will call on those who have raised their hands in the order in which they were raised at the appropriate time in the meeting. This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirements of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so the public can follow along with the deliberations. We will be featuring public comment as previously noted. Please note that this meeting is being recorded and that all attendees are participating via video conference. Accordingly, please be aware that people may be able to see you and to take care not to share the screen of your computer. Anything that you broadcast will be captured by the recording. All supporting materials that have been provided members of the body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda. I will introduce each speaker on the agenda after they conclude their remarks. I will wait for people to raise their hands for questions or comments. Please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. If you wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. And finally, each vote this evening will be taken via roll call. As we go to the agenda, we have one change, I believe, and that is under section 10, Town Manager's Report, number 1, FY 2022 budgets will not be on this evening. Otherwise,
Madam Chair?
Yep.
Sorry, I just want to mention for the public, in case they were curious about that, that is postponed to next week, January 20th.
Thank you. And other than that, I believe that's the only change to the agenda. We'll accept it otherwise. And the only announcement is that the meeting's being audio and video recorded, so we can skip over announcements for now. COVID-19 weekly update. Are there any opening comments from the public or the board? And
Madam Chair?
Yes.
I'm sorry, back to the announcements. There is just one, which I forgot to mention to you earlier today. Town offices are closed this coming Monday, January 18th, in observance of Martin Luther King Jr. Day.
Thank you. With that, can we turn it over to Roberto Santamaria?
Yes, you can. All right, good evening. I will go ahead and share my screen and we'll go from here. Uh-oh. There it is. Okay, so real quick, we're actually in a little bit, we're moving forward. We're starting to see a little bit of a lull on a testing perspective and on a case perspective. So that's really good news. Today we didn't get anything back, but moving forward, here's where we are at. As of today, we've had 22,306 tests, and we're only 996 positives. And then we've been able to tease out some of the stop the spread testing. So the total numbers are 5,400 tests were done through stop the spread so far. And of those, we've had a total positive of 84. There is a caveat on there that it needs to be noted that the stop the spread tests, asymptomatic tests, and not those who are exposed asymptomatic, go through the NCH portico. We know that many other people have been symptomatic and or exposed and sought out stop the spread testing rather than coming to the NCH portico so as to not reveal an exposure due to other reasons. So it's important to have that caveat on there because it's not all the asymptomatics on that. So we had a little bit of a spread coming in after Christmas and New Year's. We had 109 cases in the last 7 days, but when compared to last week's presentation, we had 113. And compared to the previous presentation after Thanksgiving, which was 139 in a 7-day period, it's good. It's still good information to see. So real quick, our positivity rate as of this morning is 11.6%. It's important to understand that those also includes some zeros. So we do, and it is only a 7-day average. So as we move on, as those zeros drop off, the positivity rate jumps up and down and fluctuates. So we'll talk about it a little bit more later as needed. So we're still in pretty good movement. The healthcare system is ready and going. The field hospitals in Worcester and Lowell are still up and running. But they don't, knock on wood, they still haven't been showing any information as to whether or not they are anywhere near capacity. So that's really good news. Our sewer predictive numbers still show about 25 cases per day, but I'll get into a little bit more information about that shortly. We got our this week's information this morning, so I'll get to that. These are our cumulative incidents since the very first case on March 16th. Of 2020. And it's important to note with this chart that we're looking at in that it has been almost a year since this pandemic started. We're only about 45 days away from the first case, from the year anniversary of the first case in Boston. And we are still under 1,000 positive cases. So that is important to see that the mitigation standards that we have had is still doing very well. So cumulative incidents the last 30 days, though we still have had close to, we've had about 300 cases or so, and that a little bit over 300. So the sewage information that we're seeing, we're starting to see the chart show a downward trend from its spike at last week, which is really good information. It's still showing 25 cases per day. But one of the things that I wanted to throw in here is the population estimate on the day of. So where it says here, it says using a reported flow rate of 1.29 million gallons per day. So state Title V, Massachusetts Title V says that per bedroom, based on a double occupancy, it's 110 gallons of flow per day that an average person uses, that an average bedroom uses, which is 55 gallons per day for an average person. So using that information that you'll see here in this little formula, 1.29 gallons per day over the 55 gallons per day gives us a population estimate of approximately 23,454 people who were using the sewer or had flow going into the sewer system, which includes septic flows from septic pumpers that were happening that day, of approximately 23,000 people. So it is very important to see that though we are seeing cases pop up and you hear a lot of the information about our county is still red, or Nantucket is still red on the state map. The state map is using the census number, which is 11,000 people. So we are more than double what the census rate number is there based on where it is. So I'm going to start calculating this based on the sewage flows of the days of when the samples are taken so that we at least know, have a better idea of what it is we're seeing. When we talk about the flattening of the curve, this is the 7-day moving average. You'll see the spikes that we saw coming in after Christmas and New Year's. And then what you don't see is the 2 weeks before this, 2 weeks after Thanksgiving, where the spike was actually significantly higher than these three little spikes that you see here. I say little, but little in comparison. It's all relative at this point. Using the 7-day R, we have about a 1.05 R for the 7-day. The 14-day is about 0.85 because it has been a steady downward trend. So it is still important to look at that a 1 means a 1-to-1 spread. So we want that R number to be below 1 because that means it starts burning out in the population. Across the state, this is as of a few hours ago. The state R number is at 1.04. So we are right on par with the state. And the Massachusetts number, which is actually really, let me pull this up so that we can get in comparison of where Massachusetts is with the rest of the country. So it's, of course, taking forever to load. So Massachusetts is right here. We are right smack in the middle of where the rest of the country is in their R numbers. These R numbers in green are R numbers that are less than 1. These in red are R numbers that are higher than 1. So in Rhode Island, it's exactly 1. But in Washington State, it's at 1.23. So in the state of Massachusetts, we are actually in pretty decent shape here. For people who want to monitor this themselves at home, this is rt.live is the website. And it is a live tracking of all the R numbers across the country. So we're into our vaccine plan now, and we are in phase 1, step 3. So the vaccinations for the firefighters and the police and all EMS and the workers in those departments started this week. And we've started moving forward with all of them, and we're hoping to have them all done hopefully by next week. Currently in phase 1, OIH's first rounds were done on the 5th. We already began first responders, and the congregate care setting starts in about 2 weeks after this past Monday. And we're still on track to get phase 1 completed pretty quickly. And we were in many meetings today and yesterday discussing our vaccine rollout plan for the island, and we are still in good shape. I do hope to have a nice write-up that we can have available as a 1 or 2 pages for both boards, the Select Board and the Board of Health, to digest shortly. And for more information, please call the 325-4151. We haven't updated it since Monday, but we are going to get more information out. The sign-up surveys for phase 1 and 2 are up and running. Please, if you're a phase 1 worker, sign up as soon as possible. The state is setting up so that we can only request vaccines on Mondays. So we will start pushing out our surveys to the state every Monday. So I want as many people as possible to sign up for their phase 1. If you qualify for phase 1, to sign up by this Friday so that we can get as much information. And once again, this QR code takes you straight to the town website, to the vaccination website. So I'll leave this up and running for a few seconds so that in case anyone wants to pause it, they can pause it now so that they can look at it through the phone. The sign-up sheets on the phone are a little bit, if you're using Apple OS, you do have to scroll down to your birth year. So that happens on Apple iPhones, that happens on iPads. But if you're using, from what I'm hearing, if you're using an Android-based device, or if you go on your computer, you can type in your birthday. So that's been a little bit of a source of confusion today. But with that, I would like to take any questions that we have, and if not, we can also roll over to Gary and Jericho.
Anybody have any questions right now? Jason?
Berto, I was just looking at phase 1 and phase 2. It says on phase 2, adults 65 and plus. Is Massachusetts doing it that way? Like they're not doing like 80, 70, 65 at different phases. Just at phase 2, everybody above 65 is.
Yeah, I think so there hasn't been much updates on phase 2. I got an email just a few minutes before we started this, before I started this presentation, saying that there are some changes to phase 2, but I don't think it's much on 65 plus. So I think we're still going with 65 plus, but that first step of phase 2, so phase 2, step 1 is includes 75-year-olds as well. So that's important to see because the CDC changed that and the state did adopt that.
Christy?
Thank you. So in reviewing our metrics, I know kind of way back when the pandemic started, we had set that 10% threshold for positivity rate. And, you know, we've obviously been above that for several weeks at this point. So is that something the Board of Health will be reviewing, is setting new metrics or determining, you know, when restrictions can be lifted or, you know, things like that?
So there's definitely going to be a discussion about it that I have to throw into the agenda for the Board of Health meeting on Thursday, so a week from tomorrow. Because that positivity rate is one of the things that we were looking at. So it depends on if no one metric is good. So, and that's the argument that we have to discuss. So Jericho, the hospital, and I have been discussing this ad infinitum at this point. And if it's me, it's ad nauseum, where we've gotten to the point that we need to take all the metrics in stride together. And one of them may very well be a qualitative one of, are we in a bad situation now or not? Because just because we have a positivity rate of 15% over the course of 7 days, as I was mentioning earlier, there are a few zeros thrown in on that. That may be happening after a 0 gets thrown out. So if over the course of the last 3 days, 1 out of every 100 tests comes back positive, you know, a positivity rate of 1%, but 2 of the days were zeros, and then 1 day we have a 5% positivity rate, and then that 0 drops off, automatically shoots that positivity rate up to the average, including that 5, but removing that outlier of 0. So that's where you saw the positivity rate on Sunday shoot up to 15, and then back down to about 12, and then up to 13 or 14 yesterday, and then back down to 11 today, because those outliers get removed. I would love to have a better analogy, and I know Jericho prepped me to have an analogy ready, but I just wasn't ready for it. So I'm still very technical. So Jericho, put it in layman's terms for me.
Basically, it's like if you have a class grade and you have 2 tests and you have a 0 on one and 100 on the other, the best you can possibly do is a 50 for your total cumulative grade. When we have small numbers of, with a small sample size, you get these very unusual statistical diversions from the norm that make it very difficult to do small scale metrics that are consistent and precise.
There you go.
That was a good analogy. If there are no more questions, can we go to Gary Shaw?
Okay, thank you, and good to see all of you again. I'll build on what Roberto said. We're very happy to see that the numbers continue to decline. And Roberto, late this afternoon, we did get a report back on positivities, and that number tomorrow morning will be 5. So that's a nice number to see, continue the trend. And we are also encouraged that we're not seeing a significant amount of severe illness related to the current pandemic, which is also good. But we do continue to see some people hospitalized under observation, and from time to time, it's been necessary to evac individuals out. But those are small numbers, and let's just hope that that trend continues. Roberto, I did send you a couple of emails with some graphs in it, just following with what I've put up in the past. Could you bring the pie chart up, and we'll just look at how the spread of those cases look? Thank you. Encouraging to see that obviously the cases are going down, and this is a spread. We're still seeing a little bit more in the 1 to 10 range, but we're not seeing people come in to be hospitalized. And then the bulk of the spread is really from 20 to right around the 50-year-old age. And we do feel that those are folks that are out moving about, maybe have traveled. There's a lot of back and forth that's been occurring from the island to different parts of actually the world with people testing. So that's what we would see as the spread, relatively mild disease in all of this. If we can go to the next graph, Roberto. Now this is where, just explaining where we were with patients isolating at home. One of the reasons that we saw that green line drop so significantly is that it was over the holidays, and then we had Elizabeth recalculate what she knew when she came back, and obviously that number recalculated lower, and it's climbed back up just for those numbers of patients that are isolated. And we'll see the 5 being reported out. So a positive trend overall. We know that the portico is extremely slow. And that the Stop the Spread site is extremely slow. We know that businesses in the community are largely closed. And we know that work out in different areas from trades and others where we saw problems in the past is down to a minimum. So we think that we're moving into that lull area, that slow time of the year. And it comes at a point where having a vaccine program is so important to the island. I always kind of use these natural analogies, but it's like we've come so far along, and now we're at a crack in the road, whether we're going to see more spread and we're going to see a higher rate of caseload, we're going to get vaccinated and see that to continue to drop. So from a vaccine perspective, we at the Cottage Hospital are now hovering right around 70%, 68 to 70% of the staff being vaccinated, many coming in for their second vaccinations already, which is really good to see. You can jump back out of that slide, Roberto. And so we are also happy to say that with the first responders that have come up, they're bubbly. They want to get this vaccine. They want to be protected. We're so happy that we can lean into that for the town. And it's been fun to sit down and talk to people about where we were 11 months ago, and now we're actually getting a vaccination. I think that's a modern miracle, and it's really happy to see the faces. You can see eyebrows smile behind the mask, so it's good. My chief nurse, Michelle Epps, is leading the initiative at the Cottage Hospital for coordinating the vaccine program. We are meeting through what we call an incident command structure, which Roberto and I are the incident commanders of, and there's a complete structure of many different buckets of planning and logistics and public information and so forth, where we talk through what we're trying to develop. And then we give assignments, and then we meet after receiving our minutes, and we follow up on actually the accountabilities of those being done. So I will tell you that I'm extremely pleased and proud of Libby and her team and how we've been able to connect. We work as one together. We have developed what I feel is an extremely solid plan for this community for vaccinations, and we're creating it in a scalable way, because we know the communications that are coming from the government, the federal government, Health and Human Services and CDC are indicating that potentially more vaccine stocks will be released. And we know that there's a potential for what is a trickle right now coming to Nantucket to turn into a Niagara Falls. And if that's the case, we are prepared to address it. And the worst case scenario, and I had actually call this best case, is if we could get 20,000 vaccines to Nantucket. I feel very confident that we together as a community could completely complete that vaccine regimen within 4 weeks and probably less. So that math has been done to show the throughput, for each vaccine. Essentially, it takes about 25 minutes, for a patient to come in, be registered or verified, receive the vaccine, and then wait the 15 minutes and move through. So if you just do the numbers, you can start to look at kind of what time is necessary out there to get all of this done. For us, it's just not knowing when we're going to get the vaccine. We don't control that. That's the bottleneck. But Michelle has developed some very solid relationships with the COVID planning team. And we did communicate today that we feel that all of the first responders will be done early next week or sometime in the week. And that the time frame that the governor gave for that to occur is between January and February, and we're way earlier than that. So we asked if we could potentially be considered to move into an earlier phase if we could get vaccine. That message has been carried forward, and we're just waiting to see if that's a possibility. I would suspect that there will be some resistance from the governor unless he opens that up across the state. But of course, I'm not in politics. I simply want to make sure our community's healthy and safe. So good news coming. Hope is on the horizon. A solid plan coming together. Today, we activated our website with all of the forward-facing information that Roberto just talked about. So if you call the Cottage Hospital or you get on our website, you'll see a link there that when you click it for COVID information for scheduling a vaccine, will actually, or registering for a vaccine, I should say, will actually take you to the town's website, which is well done, and will be the repository for when vaccines are arrived. Then we'll go to that, and we'll use those lists to then start scheduling probably appointments at this point in time. We haven't concretely made that decision, and we're not going to make it right now a decision one way or the other, because we're just waiting to see how much volume of vaccine we get. I see Roberto shaking his head, so I think I said that right. Small amounts, it's easy to create a schedule. Large amounts, a little bit harder, but we're ready. We have the staff together. We're training. Michelle has put together a simulation lab for vaccination skill development, and the fire department, EMS, and the staff at the Cottage Hospital that we want. And if we need volunteers, we would have volunteers that are qualified to get vaccines to go through that program as well. And there is a potential that we could put out a call for volunteers to help. We don't yet know how much vaccine we're going to get, but we do have a process in mind in order to catalog people that might be willing to help at either end, whether it's administrative or clinical. And we'll let the town know and the community know as we see what might be coming forward. Roberto, I think I covered all of my points. Is there anything else you wanted me to talk about?
I think we're good. I think it's Jericho's turn.
We do have one question. Howard Dickler has his hand raised, and then I'll go to you, Melissa. I just saw you put your hand up.
Thank you, Chair. It's very heartening to hear that the hospital and the island are ready for a surge in vaccines, because it's been reported in the newspaper that the president-elect is going to release all vaccines currently on hand. We haven't seen any reports in the newspaper that Governor Baker has input that into his distribution plan, but we're all hoping that it will. Thank you.
Thank you, Howard. Very good point. Melissa?
Thank you, Dawn. Thank you, Gary. I'm also really excited to hear about the potential of use of volunteers. In a meeting I attended earlier this week on the Cape Cod Reopening Task Force, there was some talk about utilizing volunteers, not for the clinical administration, but perhaps, sitting with people or helping organize lines and things like that. And so if we see that there starts to be this surge in vaccines and greater numbers, I'm sure that the Nantucket community would come together and we'd have great volunteers to come together to help make that process as seamless as possible. And I apologize if I missed this in anything that was reported, but there is some concern about, by late winter, early spring, as the vaccines for phase 3 start to roll in and roll out, if you will. Is there any distinguishing between residents and visitors who may be having trouble accessing the vaccine in their hometowns but coming to Nantucket? How do we manage that as a community? And will we have enough vaccine to accommodate that, I guess, is another concern. Thank you.
So this has come up on a lot of our webinars with the state as well, because we're not the only one. So basically the whole Cape and the islands are in this situation. So one of the things that we're running into is we have people who have homes here, that we have seasonal residents. It's not just people who come in, they're not people who are just flying in to get the dose because we have them available. And they have a right to the vaccine as much as everyone else does. However, when we were talking to the state, they have this set up in their distributions plans for phase 3. So as things start ramping up, phase 3 is a ways away. So as things start ramping up and populations start growing, they expect to be able to accommodate our surge in population. So we don't foresee any sort of delay in the delivery of those doses. However, the state is always the bottleneck. It's how many doses the state decides to issue to us is how many doses we'll be able to give out. But we should be able to accommodate them, everyone who comes in. And we talked about that extensively today as well.
Melissa, I would just add that, we're going to make common sense decisions for vaccinating that don't force a resident to get on a plane and go back to some other part of the country. I think that would be craziness. We're not trying to push a political agenda. We're simply trying to make sure the health and safety of the island's addressed. And then we address it as one population, not somebody that's a seasonal resident or somebody that is here year round. We're one in this together. We're all Nantucketers. We know there's going to be some unique circumstances, and we'll lean into it and we'll help people.
Thank you very much. Just as a follow-up to that, I think the concern really comes from just making sure that the state is accounting for those numbers in their distribution and that we're not limited to, I know early on in some of the figuring of statistics, we were limited to what the census numbers were, and certainly using those numbers for vaccine distribution would be disingenuous and leave us with not enough vaccine. So that was really the genesis of where that question was coming from. Yeah, thank you. That sounds moderately confident that we'll have enough vaccine for everybody in phase 3.
Well, what's good and favorable is that we're hearing the state recognize, that we have variable populations and understand it, we'll work through whatever uniqueness happens.
Great. Thank you both very much for that.
Christy?
Thank you, Dawn. I just first wanted to say that I heard Michelle Epps talk today at the hospital meeting and was just blown away. That was a great hire, and the community is very lucky to have her coordinating this effort. In the 5 to 10 minutes I heard her going over all the vaccine plans, it made me feel very safe, secure. I know that our community is in really good hands. I also heard that Nantucket was praised and recognized for implementing the best practices in the vaccine plan. So again, congratulations to the hospital and town staff for working so diligently on that. A few questions that I had. We're talking about how many vaccines getting from the state. How are we requesting those from the state? And I know that Roberto said the survey. So are we recommending people go and fill out that survey, especially when we're getting to phase 3? How will we be kind of calculating how many we need on hand week to week? And I have a couple other questions after.
Yes, we're definitely relying a lot on the survey. So that's why we want everyone to fill out the survey. So it gives us a general gross number of what to request from the state for the specific phases or on a weekly basis. So we're getting that number, adding 10% for any sort of surge. So what we're doing is the more people sign up through the surveys, the better. But once phase 3 comes out, one of the state's intention with phase 3 is to use all people registered with the MIIS for distribution, which includes pharmacists, dentists, podiatrists, eye doctors, whole 9 yards. So it wouldn't be just the town vaccinating by the time phase 3 rolls around.
Thank you. And I know that at the end of the month, airlines are going to be requiring a negative COVID test to enter the US. And I'm just kind of wondering, do you think the vaccine card will be something that will be used in travel? And, are there any things like the steamship or Highline using anything like that in the future with travel to the island?
Well, Jericho, you're having a physical reaction.
Apologies, let me step in on that. No, you cannot rely on the vaccine to prevent transmission. I'm going to say that again because being vaccinated does not prevent you from passing the disease on to other people who are not vaccinated. So having a vaccination card is not going to allow you to travel if you have not got a PCR test.
Thank you. And just my one last question. In part of the vaccination plan and the rollout into phase 3, what are the considerations if people have trouble getting to wherever the site is that the vaccines will be occurring, whether it's the school or the BFW? Will people be able to have home health care or vaccinations at their home?
Can you repeat that question again?
Sorry, if people are unable to get to a location where we're distributing the vaccines, will we be able to kind of send either hospital staff or somebody to their homes to vaccinate them?
We're hoping to be able to handle all homebound people internally through the town. So we should be able to handle that, yes, using our EMT services.
Thank you.
Great questions. Are there any, Jason?
Yeah, I watched Governor Baker talk on Friday about pool testing. They're pushing that out. Is that something that we'll have access to? Do we want it? Are the schools looking to use it? I just want to get your thoughts on that.
So we had a meeting with the schools today to discuss the pool testing. There was a briefing meeting yesterday with the state commissions as well. It sounds like the pool testing is something the school is definitely considering. At the meeting today, I don't think a decision was made directly, but I know they're definitely considering it. I think a little bit more information from a little questions that they need answered first will be answered before they implement it. But yes, they're definitely considering the pool testing because it is a PCR test. It's not the antigen test, which was originally pushed out a few months back, which was found to be not ineffective, but it was more of a feel-good thing than anything else.
Could you explain what pool testing is real quick, just because I think it's a newer thing?
Yes, absolutely. So pool testing is if you have a group of 10 people in, let's say, a classroom, you can swab all 10 people, put them together in one PCR test. So if the PCR test comes back positive, then there is at least one positive person in those 10. So then everyone does individual tests to find out which one is the positive. But if you do 10 swabs and run the single PCR and it comes back negative, then that means all 10 people are negative for COVID.
Shall we turn it over to Jericho now?
Okay, so I have 3 points to cover tonight. First is a brief recap of COVID enforcement as of this morning at 11:20. We have a grand total cumulative 198 field inspections. We have visited 156 different job sites. We've had a total of 45 enforcement actions. We currently stand at 8 citations for a potential of $1,800 worth of fines. We have 13 tips leading to enforcement, 11 requests for clarification, and based on my numbers, about 70% of the enforcement actions happen in the first month. So we have a significant drop off in enforcement actions, which I am interpreting as being an increase in compliance across the board. That basically does it for COVID enforcement. Just subjectively, I've noticed significantly fewer issues. Oh, sure, Melissa, if you had a question, please go ahead.
Just a question, Jericho. Of those 156 job sites, does that include repeat visits to certain job sites? Is that just 156 visits to job sites, or
156 job site visits? We've just started our second sweep. So of that 156, it looks to be something on the order of, if I have the number correct, it's about 17 of those are repeat visits. 17 or 18, depending on how we're parsing job site. If it's the same location, we're using it as the same job site.
Great, thank you for that.
Not a problem. Just subjectively, from what I'm hearing from my inspectors and patrollers, we are having fewer issues with compliance. The education seems to be holding, and we are seeing a lot fewer issues both on job sites and in general day-to-day behavior. Point two, I did a brief review of the olfactory screening research that we've been discussing the last couple of days. I think olfactory screening sounds better than scratch and sniff, so I'm going to go with that. So I looked at the paper that the proposal is going to be based on. The proposal is entirely computer modeling. They take a large number of different assumptions based on evidence that they've collected over the past year. They feed that into a model, and then they project outcomes based on that. One of the things that this study did very well was that they used a range of different assumptions, ran a large number of different models, and saw where the models agreed with each other, showing that there's consistent effects across different sets of assumptions. It is published in a science journal. The modeling range of assumptions seem, at least on first pass, to be extremely good. And again, they use a large number of them. So even if their assumptions are wrong, then they have a large range of potential outcomes, all of which are beneficial. If the test works as modeled, it does look like it can be used to help control spread of COVID. Unfortunately, this isn't a proposal for use. This is a theoretical modeling exercise that they want to test here on Nantucket. It will have to go through ethics certification. It'll have to be presented to us as a proposal, and it will have to be coordinated with, the rest of the healthcare response using this. Functionally, what it is a temperature check. At the beginning of the pandemic, people were taking temperatures before going into stores, et cetera, et cetera. This is a better version of that. It has the olfactory malfunction is significantly longer lasting. It presents in people who don't have fevers. So it's a more efficient way to check people's temperatures as they go into places and as they screen. It is basically a better, more accurate, and more convincing thermometer, but it's not a diagnostic tool, and it is as yet not a proposal. It's not even a research proposal yet. So we're going to be in discussions with them over the course of the next probably weeks or so to see what they want to do to get a proposal from them. And then this testing regime would have to last in the order of months before it can be turned into a public health tool. So we would be an early adopter of a testing regime to determine whether or not an olfactory screening system is effective. It looks good. Roberto is going to double check the numbers for me when he has a second, so eventually. And then we can move forward once we see a proposal from the researchers of the particular test. Final update, does anyone have any questions on the olfactory test before I move on? Oh, we do. Okay, let's go. Sorry, Madam Chair, you go ahead. No, teacher reflexes. Let's go with Jason first.
Just curious how it works. So if, do I have to tell you what it's banana or strawberries? Like, how do you know if I'm not lying, or how does it work?
So basically they use, in the model they presented, they use a scratch and sniff card with a variety of different smells on it. They ask you to scratch tab A, and then they look on their sheet at what tab A is, and they ask you what this smell is. It is controlled to a certain extent. That part of the methodology looks to be relatively robust.
Thank you.
Melissa?
Thanks so much. Just more of a comment. I want to thank you and Roberto for taking such a deep dive look into this. My non-medical and non-epidemiological opinion is that any tools we can use for screening, particularly while we wait for the vaccination to roll out and really help us take effect over this next year, is going to be very helpful for us. I think for keeping our kids in school and for keeping businesses operating. So I'm really grateful for you taking this deep dive, and I'm very hopeful that this is something that our community can participate in and ultimately can be of benefit to us to returning to some semblance of whatever the new normal is going to look like. So thank you again.
No problem. I do, again, I just want to stress this is a supplementary tool to traditional diagnostic testing, but it definitely, according to their range of models, it does look like it can reduce the R naught for a variety of different transmission models. So it does look good. Any other questions regarding the olfactory test? No? All right,
There's
my
no one
final.
in the audience either.
None of the others? Okay, sorry. Then my final point is the vaccination issues from an outreach point of view. We're currently in, I'm going to repeat some of the things Roberto said because I do think that they warrant repetition. Phase 1 submissions, we're going to be wrapping those up for the order to go out on Monday. Phase 2 submissions are currently live on the page. Some of the common problems I've seen with people signing up with it is that the survey is on the image of the phase 2. There isn't a separate text link for it. The Internet Explorer seems to not agree with the type form. So your best practices is using a browser from the century, like Mozilla and or Edge and or any of the Chromium based rendering engines will work fine. So your big three are fine. The confirmation email, that was a measure that was put into place once the system was live. There was a bit of a logic misformatting in the survey. We've addressed that. If you haven't received a confirmation email and you need a confirmation email, then submit again. We can handle doubles easier than we can handle anything else. And then finally, we will be reaching out to contact you once you've signed up and once vaccine supplies are available. So as we've discussed over the course of the evening, there is a lot of fluidity in the supply chain right now. We can't give you a concrete date or time right now, but as soon as the vaccines become available, we'll run the sorting algorithm to prioritize people based on the pre-existing categories. Then we'll reach out and contact you guys. We are anticipating mid-February beginning of the phase 2 vaccinations. That is of course subject to change, but that is about what we're looking at. I believe that is everything from me. Are there any questions? Please, sorry, I'll be quiet now.
Melissa?
Thank you, Don. Just a curious question, and this is more of an administrative issue. Would it make sense to let people self-select and sign up for phases even 3 now so that we would start to get a sense of count of vaccine, or is that just an administrative nightmare?
There's a combination of an administrative issue with that, a data management issue with that, and then a distribution channel alteration. There is going to be, to borrow a term, there's going to be a bit of a phase transition in dealing with 2 and 3. 1 and 2 are fairly similar. Their difference is scale. 3 is going to have a larger number of people providing the vaccine. So signing up now onto the town page is going to end up causing a snafu if other sources of vaccine become available. So if you're signed up on the town site, you also can go to your doctor, et cetera, et cetera, et cetera. So right now, because we don't know the shape of the phase 3 distribution, phase 2 and 1 have to be kind of kept in a separate silo from them.
Thank you.
Okay.
Any other questions? Great job with all that information tonight. Are we done with COVID-19 for this evening? Do we even first update? Oh, sorry.
Yeah. So as we discussed last week, we've established an economic task force. The tri-chairs are Janice Schulte, Director of Culture and Tourism, Melissa Murphy, Acting Director of Chamber of Commerce, and Christy Ferrantella, who is not only a select board member, but a member of the Planning Commission. And I think you guys met today. They've managed to recruit some people to be on the task force. And I think through, I'm not sure who, they have a brief update.
So it's me. Thank you, Libby. Yes, we have, we met today to have our kickoff, and we have per our mission, we're trying to keep the task force small and mighty. So many thanks out to Patrick Ridge from Island Kitchen, who will be representing restaurant industry, Karen McCumber, who manages our Nantucket Island Center for Entrepreneurship programs, but also at the Chamber of Commerce, but also runs a lodging establishment. Mark Donato will join the team as a general business representative, and Bess Clark in retail. And then Leslie Snell and Amy Baxter will be joining us to participate. So we are scheduling our first meeting for next week. We've got a nice agenda set up, and our hope is to have action items for each person. So we really made clear to our volunteers that this is meant to be an action task force. And once there are no actions left to do, then we'll cease meeting. But we're excited to get started. And I think scenario planning, communications, all of the things that you fellow board members endorsed in our proposal last week are going to be the topic for conversation and organizing first steps. Janet and Christy, did I miss anything?
No, I think you hit everything we talked about.
We drafted a small mission statement today so that it will help direct our conversations.
Yeah, and we're going to vet that with this group and just make sure that we're all in agreement with it, but we're excited to get going.
Excellent. Thank you. I don't think there's anything else on here unless there's other questions or comments. And no hands raised. So I'll move on to the public comment portion of our agenda, not related to COVID-19. This is when anyone from the public can raise an issue to bring it to our attention. It might not be commented on this evening, but this is the opportunity. Not seeing any hands. No new business. Approval of minutes and warrants. Can we take all those together? Is there a motion? Is there a second?
Second.
All those in favor by roll call: Christy Ferrantella.
Aye.
Jason Bridges.
Aye.
Matt Fee.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you very much. Citizen departmental requests. We have a request for a waiver of our sewer connection permit fee for a Covenant home located at 5A Green Meadows Drive. This is consistent with our policy. I think Tucker's here for this.
Thank you very much, Madam Chair. Yes, this is a fairly straightforward request from Holly and Peter Fernandez regarding their home at 5A Green Meadows Drive for the sewer connection fee waiver in accordance with your policy. This has been a standard practice, and we would request that the board grant the waiver.
Matt?
I'm supportive of it, but I'm going to disclose he's an employee of mine.
Does anybody have any questions or motions?
I'll make a motion to approve.
Is there a second?
Second.
All those in favor by roll call: Christy Ferrantella.
Aye.
Jason Bridges.
Aye.
Matt Fee.
Aye.
Melissa Murphy.
Aye. And I just wanted to say thank you. It's so helpful, particularly as a new board member, to have the staff recommendation and the understanding of it against our policies. It makes making a decision very easy. So thank you.
Thanks, Melissa.
Thank you.
That carries unanimously. Housing Director request for letter of support for 6 Fairgrounds Road housing application for tax credits. Tucker again.
All right, excellent. Thank you very much, Madam Chair and members of the board. Actually, very glad to have the opportunity to make this request tonight. This is for a letter of support to accompany the application for a tax credit award for the 64 unit housing development at 6 Fairgrounds Road, otherwise known as Tacoma Green. As the board I know is aware, this was held up for a couple of years in litigation. That is now behind us, and this project has been invited to apply for a tax credit award this year. So we are cautiously optimistic it may occur in this round. And these rounds only happen once a year. So this as a general rule. And so this is kind of an important milestone. So we would request support for this letter. Again, as the board is aware, this project will comprise 64 units, 80% of which will be restricted at the 30%, 60%, and 120% AMI level. The entire project will count on the SHI list as well. It will serve entirely the year-round community.
Matt?
Yeah, I move we support it.
I'll second.
All those in favor by roll call: Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. Thank you very much.
Thank you all.
And number 3, Preservation Planner Holly Backus is here. Request for approval and execution of assurances for the Certified Local Government Program application. This is something the Historical Commission and the HTC are doing jointly. Holly?
Yes, thank you, Madam Chair. Last year, we were before you talking briefly about the Certified Local Government Program through the National Park Service. And both the HDC and the Historical Commission have agreed mutually to move forward with this application. To give you an insight, the National Park Service has the certification program to help communities save their irreplaceable historic character of places. Through this process, communities make the commitment to historic preservation. Obviously, preservation has been very important to Nantucket, being a certified local government. We are a National Historic Landmark, so this would be obviously a great additive to our just the island in general. This certification by the National Park Service also provides the town with additional funding opportunities and from the Federal Historic Preservation Fund, additional assistance from the Massachusetts Historical Commission, as well as our continued commitment with sustainability of our historic community. As the preservation planner for both of these commissions, as a staff liaison, I highly recommend this application. This is for the assurance page. Basically, you all are certifying that we would fulfill the guidelines of the application. Also, I wanted to let the commission or the select board know that the preliminary historic preservation funding grant through the MHC has invited Nantucket to the second round of the grant process, and we have are working on that application. They're actually putting us in with the certified local government group. Under federal law, they are required to provide 10% of their federal funding each state historic preservation office to CLG. So this is a great thing to go towards. Out of 27 applications that the state received for this pre-application for the grant, Nantucket was one of 18. So with that, I just recommend or ask for your recommendation on this. Thank you.
Does anybody have any questions or a motion? Matt?
I think it's great. Thank you, Holly, and thank you to Historic Commission and HDC. It's really great. So I move approval.
Is there a second?
Second.
All those in favor by roll call: Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. That carries unanimously. Thank you, Holly.
Thank you very much.
Next up, I'm going to reopen the public hearing to consider amending the Town of Nantucket regulations for the use of town-owned beaches and town-owned land adjacent to ponds and pond areas with respect to activities that might attract sharks to swimmable areas of Nantucket beaches. This is continued from December 2nd, 2020, and I'm going to go right over to Jeff Carlson.
Good evening, everyone. Hopefully my audio is fixed from earlier when I couldn't speak. So
You're good.
Excellent. So it's just kind of a follow-up from the last meeting. We did a little legwork to look into this a little further, and we were reached out and spoke with Dr. Gregory Skomel. He's the senior fisheries biologist for the Division of Marine Fisheries, and is kind of an expert in sharks and shark biology. That's his area of expertise. And he provided us some clarity that there's an existing state regulation that does prohibit chumming for white sharks. That's on the books and valid. I know that was some confusion last time. And then also detailed to us, and we've actually been subsequently contacted by an additional researcher looking to do some research into tracking sharks in and around Nantucket. And I think we felt, after talking to both those parties and with the state regulation, that the most prudent path at this point is to rely on that state regulation and then work with the DMF and this independent researcher on getting some more information on sharks around Nantucket, and then maybe revisiting it at a future date. But at this point, the prohibition on chumming for white sharks would probably cover what the intent of this was originally.
Thank you, Jeff. So would we just make a motion to table this? Or to?
I think so, or to take no action. I would defer to Libby for which
No
one's
action.
correct.
Take no action.
Matt?
I'll make a motion. We'll take no action.
Sorry, you still have your public hearing.
I got to close the public hearing first. Sorry.
Oh, sorry.
Let me just make sure that there's no one from the public who wishes to speak. I'm hoping that this has relieved people's concerns. I'm not seeing any hands, so I'm going to close the public hearing, and then I would love to take a motion. Matt?
Oh, I'll make a motion to take no action.
And second?
Second.
Thank you. All those in favor by roll call: Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Don Holgate, aye. That carries unanimously. Thanks, Jeff. Just keep us posted if there's
Definitely. Thank you for the time.
to follow up on. Town managers report. I'll turn it over to you, Libby. I know number one is off.
Thank you. Number one, yes, is postponed to January 20th. Item two, which is second quarter budget reports for the current fiscal year, fiscal 21. We have not all of them, not all of the enterprise. We've split them up week by week. The rest are next week. But today we've got Wanacomment and Sconset Water, Sewer Enterprise Fund, and Solid Waste. And I think we are starting with Wanacomment, Sconset.
Thank you, Libby. Good to be with you guys. I'll say it again. Hopefully soon, in a few months, we can do this, or maybe by fall, do this in person would be good. For us, the first 6 months of 21 have been pretty good. Our revenues are up 13% compared to a year ago. That's derived from water use fees that are up $293,000 and connection fees that are up $229,000. The water use fee, to put a kind of a gallon number to that, 293 gallons is 50 million gallons more in the first 6 months of 21 than last year. So I know the summer months we had great weather. It was really dry. The water was getting used for irrigation and other purposes in dry weather. As we moved into October and irrigation systems were starting to be shut down, we still were seeing 7 to 8 million more gallons a month being pumped through the fall. I think we can all understand it was a pretty busy fall. We're finally starting to see it. It looked like between Thanksgiving and Christmas, the flow numbers from the pumps started slowing down, getting back more to a normal flow for this time of year. I've checked with David, and his flows kind of match what we're saying. And to go back to what Roberto said earlier with the population number, our flows match those population numbers he's coming up with as well. The 229,000 on new connections represents 46 new water services in the first 6 months through the second quarter. So revenue-wise, we're in a pretty strong place. Operating expenses are down about 20% compared to last year. There are a few other expenses that are up quite a bit. Our repairs and maintenance. One thing that goes with increased in pumpage and running the system harder longer is things tend to break. We've had a lot of water main breaks, some big ones in town, some smaller ones on the outskirts. But that line item for us, repairs and maintenance, is increased, $87,000 over last year. So we've had to dump a lot of money into those repairs over this period. But all in all, the beginning of this year has been pretty good for Wanacoma.
And do you have any questions for Mark? Thank you, Mark.
Sconset's been slow. All revenue from Sconset for the first 6 months through the second quarter of this year comes from water use fees, so the selling of the water. There has not been one new connection in the last 6 months. The pumpage out in Sconset is up 12%, so we saw the increase in Sconset as well. Right through mid-December, it started to slow down a little bit, but not quite as high as town, but there was still up for Sconset. Again, operating expenses are down a little bit in Sconset. We're trying to keep those down on for a good reason. And luckily, knocking on my desk, there hasn't been a need for any major repairs or any serious breaks out in the Sconset water system so far. So we're able to keep better eye on that budget line. Other than that, Sconset's doing well.
Any questions for Mark? Okay. Matt?
Yeah, Mark, it's Matt. I'm going back to Wanacoma. You had permanent on your wage. You had laundry and housekeeping as under headings, and then they went away. And I understand. I added them up, and they're all in the one category now. But what is laundry and housekeeping for you guys?
That's just our cleaning service. That's just the cleaning service for the office building, Matt. We don't have any laundry or anything like that.
Okay, got it. Thanks.
Any other questions? Thanks again, Mark.
Thank you.
Go ahead, David. I think is David next or Rob?
David.
It's David
Right.
on the agenda.
Thank you, everyone. Good evening. I think I agree with Mark. It'd be nice to see everyone in person coming up soon. I finally did get to see Libby, Matt, and Jason in person, not last week. So sewer revenue, total revenue in the first quarter here, we're up about 1.4 million. It's about 28% increase in the first half of 21 over 20. A lot of it had to do with usage, but we have had a dramatic increase in permitting in the first quarter. We've already issued 264 permits in the first quarter of 21, and we only issued 400 and something total in all of 20. So we're on a record target here as it stands now. The permits have really increased tremendously, like I was saying. We have noticed that with a lot of the permitting in the Shimo area that we're finding, and a lot of the SPF fees, a lot of them are being paid up front and full. So that's seeing a different impact as well on some of our numbers. The other increase, like I said, has just been the amount of pumping. And in the last couple of upgrades that we did the big upgrade here at the Surfside plant, and we did the big plant done the upgrade at C Street Pump Station. And those two projects generated some significant revenue from us from back on electric rebates. We're well over $80,000 in it altogether in just rebates. So a lot of the work we're doing is now meeting new efficiency standards. So we're starting to get a lot of National Grid rebates and different programs like that. Our expenses were down in the first 6 months of the year. I can't say it's because everything was running smoothly, because that doesn't happen in my world, but we've been able to do a lot of work in-house ourselves. So we haven't had to hire a lot of repair work out. So that's making a big difference. And to go from there also, as Mark said, in Sconset, we're seeing flows now still in Sconset twice the amount that we normally see. Usually we are around 11 to 13,000 gallons this time of year, and we're still up in the 20s to 30,000 gallons a day. So still a lot of people in Sconset. One thing that we're seeing in Sconset, and I think Mark is seeing as well, is a lot of renovation work going in Sconset. A lot of houses being picked up, renovated, additions going on. We had a permit issued the other day. Someone just added 5 bedrooms to a house. So we've been very busy with permitting. I don't know if anyone had any specific questions to go through, but if not, that's about all I have so far.
Does anybody have questions for David? Matt?
Not so much a question, just a comment. And it's when in our packet, we get a 4-year look back. So, we've got, what is it, 18 through 22, I think it was this time. And I always look across and say, how much did salaries go up? How much did all the other line items go up for that 4-year period? In the sewer, it was up 42% in 4 years, the salary line item. Medical was up 86%. I realize there's new hires and there's new people that have been brought on. But I think one thing for us to be thinking about, when we look at these as sort of as a select board, as the governors of the island, is we have to be thinking what's going to happen if and when things slow down. This can't be going straight up forever. And these budgets, a lot of them are very reliant on growth. They're very reliant on getting more and more and more. And so I think we have to sort of be thinking about that and be sort of hedging our bets. We want David and other department heads to be thinking, what happens if I don't get $200,000 in new connections? And so it's just a comment. Everything looks great, David, but it was just, we're some of these that we're going to be seeing. The airport, I don't think we're doing this week, but it's, we've got to be thinking about it.
Oh, and I thank you, Matt. That's one thing I am looking at very carefully. We did just get formed in 2016, so we actually came out of the gate in 2016 brand new, and we have grown. And with the uptick in what happened with Shimo, we know we're talking about Nantucket in the future and other areas. So I don't think we're going to see too much of a slowdown in the immediate future, but I am looking at the long range forecast for sure. And I do want to thank you and Jason for coming down to see the lining project that we just did. I think everyone was pleasantly surprised at what they saw.
I was going to bring that up in select board comments, but it is really interesting what you guys are doing. I don't think a lot of people know. Can you just go over really quick how you're cleaning and lining and what that process is, David?
I can, yes. What we're doing is we're lining most of the older mains that are structurally sound. Anything that's like 1920s to 1940s that's actually still structurally sound. We have pulled in inverted liners that are saturated with an epoxy and that they're cured by pressure and steam. We have done all of Westchester, Eastern Street, Old South Road, all kinds of outroads and areas. We also got to show you a couple of the manholes that they're doing. A lot of these manholes were installed, a lot of them with red brick or just cement brick in the 30s by hand, and have since just started to disintegrate. And these guys can go in and eject some epoxy and then line the inside of these manholes. And it's all structural lining. That's scary. It says it has a 50-year life. With what we're seeing so far and some of the stuff that's been done prior, it's amazing. And I would say just alone in paving for this project that we just did this year, we've probably saved about $2 million. just without having to do any excavation, small excavation work, but nothing. If we had to do all of Eastern Street, it would have taken us probably 6 months of dewatering to try to replace all those mains, and we did it. We did land that whole street in a matter of 3 days. And we're already seeing a drop in C Street. We've already seen probably over 100-something thousand gallons just alone since we've lined Eastern Street in the last couple of weeks.
That's great, David. Thank you. Thank you for explaining all of that. I'm going to go to you, Matt, in 1 second, but Mark Willett, can you mute your computer? Yeah, still on. Thanks. Matt?
Yeah, no, it looks like a white bed liner, like a spray-on bed liner they put in a truck. It's a white and looks like that. It was pretty amazing. And I want to thank you, David, for being so excited about sewers. We're lucky that someone is excited about it.
Well, I thank you, everybody. And it was really neat to see. And I'm going to be having a little presentation for everybody coming up in the coming weeks, a month, that shows the process from beginning to end. It's very neat. And they're still lining all next week. If anyone else wants to see it, just let me know.
Awesome. Thank you. Rob McNeil?
Good evening. So the story is fairly similar to quarter one. First half has been, the revenue has been slightly down. We've seen quite a bit of fluctuation with incoming materials. We've had a fair amount of construction activity, as you know, all around the island. And we had quite a bit of leaf and yard waste really tended to explode again in the fall, and it really kept going into December. Some of the expenditures that have popped up include kind of one-offs where we're hauling tires by the trailer load. We're doing more C&D clearing out of the building to keep the inventory in the building down. And that kind of happens in big chunks. And then we've seen this interesting blip happen around the holidays this year, where we're seeing a real explosion in mattresses coming through. So I mean, the good news is that we've actually gotten a DEP grant somewhere in the neighborhood of $80,000 that covers essentially the next 2 years of mattress costs for recycling. But it's really the quantity that's coming through is rather interesting. But year over year, we're on target. Just to remind the board as well, tomorrow we have a meeting scheduled for our request for expressions of interest for parties that are potentially interested in managing part of the landfill operations or the entire landfill operation beyond the 2025 Waste Options Nantucket Waste Services Agreement. That package went out just before Christmas, and responses are due back at the end of January. So tomorrow is sort of a Q&A opportunity for expected applicants. And so far, as of last week, we have received, or over 48 people have individually downloaded the package. So it's exciting to see that we've gotten a fair amount of activity this early in the game. And our consultant, George Aronson, myself, and our recycling coordinator, Graham Durovich, are all very excited to participate tomorrow, and then to see what this process gets so that we can review it together with the town manager, and then come back before you with some options and hopefully some recommendations.
Christine?
Thank you. Not a budget question, but a question just in general. Have you done any waste sorts recently to see how our new waste streams are doing during COVID? I think there's been a lot of increase in single use, and I was just interested
Sure.
how it's going.
So we actually did our winter waste sort today. They just finished that a little while ago. Interesting on that particular effort was the afternoon session closed up early and without a private hauler packer truck, because no private hauler packer trucks came into the facility after 1:30, which we haven't run into before. We typically do the winter sort in November, and it was delayed. And so doing it in January, we had an interesting thing come up today that hasn't happened before. But we do have numbers for August, the waste sort we did in August, and I'm happy to provide those to you with Christy.
Any other questions for Rob?
Matt, just a comment. I think I'm amazed we have that many people applying. That's are interested, Rob. That's really good news.
Agreed.
Is a board member sitting in on that Q&A tomorrow, or you're
certainly welcome to.
Okay. Okay, just curious.
Yeah. I'll make sure the town manager has that information.
Okay, what time is it?
Let me double check. No. Right now, it is scheduled at 11 o'clock.
Thank you.
Thank you.
I think that wraps up town manager's report.
Thank you very much.
Thanks. Select board reports and comments, determination as to rescheduling the 2020 4th of July fireworks show. Hi,
Good
Jan.
evening. We continue the saga of the 2020 fireworks show, and I sent you an AIS with a timeline of how this decision has been rolling out. And when I wrote this AIS in December before New Year's, I had made a recommendation that we double up the show, take the 2020 show, which is funded in this fiscal year, and the 21 show, which is funded in FY22, and do a double show. But in light of the reality that we're seeing some major events that happen on the island start to indicate that they're not going to happen, like the Fagawi race is not going to stop here, and the Pops is not going to happen, I'm going to withdraw that recommendation and suggest that we cancel the 2021 fireworks show altogether.
I know that with the New Year's decision, we really had until November to make that. Do we have a drop dead date on when we would have to make this decision by? Because I'm just wondering if it might be a little bit premature.
My sense from Mr. Shea at Atlas Fireworks is that he needs about 6 weeks to do the permitting, and we do not have a determination from the Coast Guard whether they would allow 2 barges out there, because basically it's 2 fireworks show going on simultaneously, and the Coast Guard would have to approve that.
Oh, I wasn't thinking about the double show. I was just thinking about the single show.
Well, yes, then we have that. Yes, we have that possibility to delay until a decision until.
Like if we discussed this, say, in April or May.
Mm-hmm.
Melissa?
Thank you, Don. Curious if we don't double up, and is there any other way we could repurpose the FY21 funds and redirect them to something else?
I think I'd need Brian and Libby's help with explaining what we might do with that.
Okay.
Go ahead, Brian.
Thank you. It depends on what you wanted to do with them, Melissa. If we wanted to do something other than within the culture and tourism budget itself, then it would need town meeting action to transfer the money to another spending initiative.
Okay. I think I was thinking about our economic recovery task force, and one of the things that we've talked about is some kind of support or grant program or something like that, or there may be some initiatives that come out of those recommendations, and certainly I understand waiting on making a decision for the FY22 funds for 1 4th of July show. But if we're not doubling up, perhaps we can start to research how we might be able to use those funds to be responsive to our business community needs this spring.
Libby?
I'm just going to echo some of that. We have had a lot of internal discussion about this, and we honestly go back and forth all the time. Should we, shouldn't we, should we, shouldn't we? I started a little mini poll today of some other towns. Are they doing it? I heard immediately back from the town of Sandwich. They are most likely not going to have 4th of July fireworks this year. I think our concern is that even in July, gatherings are still going to be an issue, especially gatherings of that size. So last year, when we were struggling with this, we were hearing that people wanted a decision one way or the other, so they just know, are the fireworks happening or not. So that's another reason why we were trying to just get this dealt with. The repurposing of the funds could definitely be done. It was seeming to us in our discussions to be perhaps more appropriate. It's really not a very big deal. We have budget transfers at town meeting all the time. And that would be pretty straightforward, I would think.
Melissa, then Christy.
Sure, thank you, Dawn. Just as a follow-up, then I would recommend us, and I agree with you, Libby. With my chamber hat on, we are hearing about the shifting of event planning, particularly for crowds where you really can't control numbers. It's unlikely that we're going to be in a position where we can support those kinds of things. But if this board feels more comfortable waiting on a single firework display show and a conversation about that later, I think that's great. I would love to have Janet be able to use some of her discretion to reallocate those funds for some of these economic recovery efforts. So that's my position. Thank you.
Christy?
Thank you. I think last year when we were toggling back and forth, there was so many unknowns. And I think we know a lot more this year about, what COVID is going to look like and what the vaccine distribution is going to, hopefully look like. I'm not confident that we're going to be in a capacity to hold anything this summer. And I think, for businesses and for our community, it's better to make the decision tonight and see how we can reallocate those funds. And I like Melissa's idea of supporting small businesses or using those funds towards something with culture and tourism. But I think trying to delay the decision, we're going to be in the same spot 3 months from now, or we can kind of see what the future is going to look like with COVID.
Jason?
I think we've learned that we don't know really what's going to happen at all. I mean, it could be worse. It could be, I doubt it'll be better than we think, but I'm okay with delaying it till April, right before town meeting. I do like the idea of reallocating one of those and letting Janet and her team decide in the task force how to reallocate that.
I completely support reallocating the funds from 2020 and having the economic task force use their discretion on that. I'm just personally, which I might get outvoted, not ready to make a decision on canceling the 4th of July fireworks. It's an event where people do spread out, and it's not until July. And I certainly think that we should cancel any Main Street activities. I think that that's unrealistic to do, but I'm on the fence about the fireworks because it's an outdoor thing that maybe can happen this summer, but I would just be more comfortable making the decision later. But if everyone else wants to cancel it, that's okay too. Janet?
A point of clarification. So we're talking about, we are going to cancel the 2020 show and talking about reallocating that money. And I would argue, thank you. And I would argue that given my role on the economic task force, that we could say that that's a function of culture and tourism to support small businesses by making small grants to small businesses. Probably operated through whatever the chamber is doing now in the structure that they've already set up. No need to duplicate it.
And let's not get into the details of how specifically how the money would be used, because there are issues with grants. And but the task force can certainly figure out, I'm certain, appropriate expenditures which relate to economic recovery.
Melissa?
Don, I'm perfectly comfortable waiting to make a decision if that is, you know, the way to go on the July 4th, 2021 show. If we feel more comfortable waiting to see how the vaccine rollout goes. I will just reiterate though that event planners in our community and organizers are trending towards not executing large scale events. And I think that's simply because even though people can be outside and spread out, there's no way to enforce 6 foot separation and mask wearing and all of those things. So, however, I love your optimism and I want to join that train. So if waiting makes sense for everybody and there is no rush, then I agree with that. Let's not make a decision tonight. And I appreciate the support of reallocation of the fiscal 20 funds to the task force. Thank you.
Matt?
Yeah, I support the reallocation. I'm okay with waiting, but I think it should be, I don't know if we should wait all the way till April. You know, I think we should wait another month or two, but you know, my sense, you know, I advised a friend whose daughter is being married and wanted to do it this spring, early summer, and they're moving it to September, October. And so I think that's, you know, I think that's where we're heading if I had to guess. And I think Libby's point of giving people plenty of time so that I think we just sometimes we hold, you don't want to hold out false hope. You know, I don't want to hold false hope to people. I think it might be giving the wrong message. So I think I would like to see it back in, 4 weeks, 6 weeks, not the full 3 months.
Libby?
At risk of overstepping, I would encourage you to make the decision now and just cancel it. Only because if the POPs is already canceled, Fagawi is not going to be happening like it normally does. POPs is in August and it's already canceled. Why would we wait a month?
I just think the POPs is a very different event than fireworks.
I'll be the Grinch. I'll make a motion to cancel and see if there's support.
Is there a second?
I'll second that. I think it's a smart decision to make now.
Okay. All those in favor by roll call. Matt Fay?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
No.
Melissa Murphy?
Aye.
Don Holgate, no. 3-2. I guess the fireworks are canceled. Can we then reallocate those funds as well?
Well, that budget hasn't been approved yet, I don't think, the FY22.
Right, but we have to have it ready for town meeting.
Then I would suggest I need to talk to Libby about how to set up some conversation Libby and Brian about reallocating this year's funds for another purpose, and then what we might do with what's in my proposed budget for 2022.
Jan, I think we figured out maybe we can just repurpose all of it to economic recovery.
Christy?
Thank you. Is it possible to do a New Year's Eve for 2021 as we had hoped in 2020, or is that not worth exploring?
We have talked about that. We had just a little bit of a discussion about that today, and that's iffy again. Perhaps slightly better, but what we found this year, the police department said they were keeping an eye on staffing around that time, because remember, we were going to do that. And there were not a lot of people on duty. People were out on vacation. There was a potential staffing resource issue even then.
Melissa?
Thank you. I will defer to Janet. It's your budget, your line item to figure out, but the economic recovery landscape for July may look very different, and we may find another way to use those funds to have some other kind of celebratory town event when we feel like it is safe for us to congregate and return outside. So I appreciate the patience of waiting and seeing what might happen after this July-August timeframe passes by. There may be another cultural event that a town-sponsored cultural event that seems appropriate in that fiscal year.
So I think at this point, if we're canceling 2 years of a 3-year contract for the fireworks, that I should touch base with Brian tomorrow to talk about the entire contract and what we might do next.
Okay, why don't you guys get together on that, and to be continued on the rest of this. Next up, we have the review final draft potential adoption of 2020-2021 strategic plan update, continued from December 9th.
So Madam Chair, I don't know if you want me to take this one on, but I will just refresh everybody's memory that at your last meeting on December 9th, I think the board you reviewed the strategic plan as it had been drafted with the focus areas. Some had been revised with some new or additional goals. And the one that was causing some discussion that people were not entirely comfortable with was a housing goal. And it currently reads, it's in your packet, identify incentives to encourage homeowners to use secondary dwellings as year-round rentals and explore options for limiting the conversion of year-round housing to short-term rentals. So you all were thinking about that goal and discussing the concerns. And I asked Tucker to take a look at what might be a little bit of a revision. And he sent that around. I did not actually have a chance to send that around to everybody today, but I'll read it, and then maybe Tucker, you could just comment on it. Christy sent me some wording too. The Tucker wording seems a little bit more direct, I guess. And it would read, provide incentives that encourage homeowners who rent their secondary dwellings seasonally to instead rent them on a year-round basis. Right, Tucker?
There was a bit of explanation on the wording.
There was, yeah. Tucker, do you want to just explain it? Or if you don't have it right in front of you, I can read what you said in your email.
If you wanted to read it, Libby, I'm happy to then comment on anything that's helpful.
Okay, I think the reasoning was this targets the rental of secondary dwellings for year-round purposes, which I think is what we want to see more of. And I guess that was actually it, what you said, Tucker. Is that it? Maybe I don't have your whole thing here. Oh, I'm sorry. You did have a more detailed, it's kind of long. Do you want me to just read it? Or
sure.
Do you want to, sorry.
That's right.
So there's two parts to this. The first part of this sentence goes to providing an incentive to utilize available secondary housing for community benefit. If the Affordable Housing Trust is financially incentivizing someone to rent year-round, the trust is limited to serve low to moderate income levels and therefore would require a deed restriction on these units. And that could be an issue for people. There are two types of homeowners who have secondary dwellings. One, those who use the secondary dwelling for their own purposes, for families, guests, staff, things like that. And two, those who rent their second dwelling, maybe short-term rental wise. we would expect there are a few folks in that first category who would put their secondary dwelling into a program. In the case of the short-term rental group or the other group, there would need to be a strong financial incentive or a new bylaw restricting the ability to rent seasonally. We're not sure how removing a right that a property owner currently enjoys would work or be received. Would it apply only to newly constructed secondary dwellings? Would things be grandfathered? We're not too sure. Oh, thank you, Erica. So this is the current wording, but we're talking about modifying it. And I wish I had your wording up, Tucker, but I only have it on your email here. I think that was about it. Do you want to elaborate?
I mean, I'm happy to answer any questions, or we tried to take a look at the current wording, understood that maybe the board wanted to tweak it a bit, and so we really tried to aim this toward what we understood the intent to be, which is to try to incentivize those folks who presently are renting their secondary dwelling on a seasonal basis to instead think about serving the year-round community.
Melissa?
Thank you. I was just going to ask if we could hear Christie's Christie's version, just for comparison. I'm curious what your thoughts were on that. So thanks for raising your.
I'll have to find that to read it back to you, but I was just wondering if Libby could read Tucker's one more time. I'm more of a visual than hearing over the screen.
Maybe you can just email it to everybody.
Yeah, I was trying to email it to Erica to put up. If you give me a second, I can get Christie's and Tucker's on one piece of paper. So just if you
okay. Brooke Moore has her hand up, so I'll go to Brooke in the meantime.
Can you hear me, Dawn?
Yes.
Thank you, Madam Chair. I just wanted to make a couple of comments. I'm deeply appreciative of the addition of the develop a strategy to increase home ownership opportunities for middle income workers. I think that's a great addition to your goals. I do want to say that where I get stuck on this incentivizing people who are renting to rent their secondary dwellings year-round versus short-term is that there are, I don't know how many hundreds of people, including myself, who rent our secondary dwellings year-round already. And I wonder whether in doing this, the town will be opening ourselves to having to answer the question, what about those people who are already doing this? And will they be then eligible for the same incentive for something that's already happening? I'm not sure it's a deal breaker, but I just wanted to raise that that question that came up when the Housing Trust had a conversation about this. So that's all I wanted to share. Thank you.
Thank you. Matt?
Yeah, I think Brooke makes a good point. Does everything have to be incentivized or paid for? I think there's ways to do it without that. And I'm not sure it's just seasonal to year round the way I don't want to I don't want to make this so fine and sort of make the scope too small. I think the goal here is, I think the problem that we're facing is that we have, the problem we're facing is a lot of year-round homes are being converted, and we've lost 600 or so over the last couple of years. So how do we explore how to discourage that from happening? How do we discourage the conversion of year-round housing, year-round or rental housing into seasonal housing? I'm not, maybe that should be maybe that's what we should be saying, is explore how to discourage the conversion of year-round housing units. And maybe that's, so I think it isn't just, so anyway, that's.
Christy?
Thank you. Matt, I think what you're saying is correct in the way of, trying to encourage more year-round housing. So instead of using the word discourage the conversion of year-round to short-term. It's more so how can we encourage either the creation or sustaining the already existing year-round housing.
Yeah, I'm the Grinch, so I'm looking at it negatively. So I guess, but yeah, but that's the issue. And so how, positively and negatively, how do we do it? Positive and negatively, that's something that's hurting the fabric of our community. How do we, my sense for the last 20 years is we need a bifurcated housing market. One set of housing for year-round and workforce people. Some of it's, and then one set for everybody else. I don't think the market is, we as employees and owners here can't compete with the outside pressures. So how do we set that up, over time? And that's the, big picture, the macro picture of this.
I mean, I think we have made a lot of strides towards setting that up with the apartment housing that's being built and with the Covenant program. The Covenant program is wildly successful. How do we encourage more Covenant units? Melissa?
Yeah, I would just say in terms of, the goals, without going down sort of the rabbit hole of trying to solve housing tonight, I think, Matt, that macro goal is represented in the goals, determine in greater detail the need for housing at all affordability levels. And I think in this specific goal, we're trying, and I do actually like the word incentivize, because I think there are ways, maybe not necessarily through direct cash payments, but is it through tax incentives? I mean, this is where the thought really needs to get played out on, what is causing some people to, the market is driving any sales. And there may be not much we can do about that. So in this particular narrow area, are there ways that we can incentivize people who have second homes to keep those, renting them year round? And I would almost, add to that, is there a way to incentivize some of our seasonal residents to rent their homes in the off season? I mean, that was a practice that was happening a lot when I was growing up and happens less and less now. And I know that contributes to the shuffle and isn't great, but we've also lost a lot of opportunity for people to have a shuffle. And there's not as much to go on. So I like that incentivized language, and in the scope of all of the other goals that are there. I don't see too much of a tremendous difference between Christie and Tucker's. I think they both get at the heart of what we're trying to do, which is in that specific area of year-round homeowners, find some ways to make it less tantalizing to do a summer rental and put a year-round family on your second dwelling.
Thank you.
And
Melissa.
we may not be able to solve that, to be honest with you, because the rental rates are so high and the earning margin is so great. I'm not sure we can develop incentives to make that difference up for people who are taking out now $1.7 million mortgages for a year-round family home. But why not give it a shot is kind of my perspective.
We have a couple of hands raised. I'm going to go to Brooke Moore and then Mary Longacre.
Thank you, Madam Chair. I want to follow up on what Matt said in terms of disincentive. I find it interesting because as a person who was a summer person here from the 80s and observing what happened with the secondary dwelling bylaw and the original sort of narrative around the intent for creating it and what it has become. And perhaps the board might want to consider an analysis of the impact of the secondary dwelling bylaw relative to its original intent. And is there an amendment to that bylaw, maybe to use Matt's phrase, to create a bifurcated secondary dwelling market, those that preceded a change and those that are created in the future as being restricted for year-round occupancy. It's just a thought. Thank you.
Mary Longacre.
Thank you. I wanted to follow up on Brooke's first comment. You got to be very, very careful when you change the landscape. For instance, if you were offering any kind of benefits to a property owner to convert from seasonal to year-round, what you might end up doing is creating an incentive for people to convert from year-round to seasonal for a year, so that they could then get the benefit the next year to convert from seasonal back to year-round. So whatever way you change the system, you want to be really careful and put up some rails to prevent people from gaming the system. Thank you.
Thanks, Mary and Brooke. Matt?
I'm happy with either wording. You know, we're not deciding it tonight. It's asking to explore. And I think some of the ideas that we've talked about should be explored. I'm happy with either of those.
Christy, what do you think? But had you seen Tucker's wording before?
I hadn't, but I'm happy with Tucker's wording as well.
Okay. The only thing I would say is, Christy, and yours I think is good, but I think that the second part is already covered under a different goal. The creation of more year-round housing in the next goal. Tucker?
I think that's true. I just was going to comment that you might, if you liked the wording that I suggested, I think Matt just kind of modified it from provide to explore. You might consider making that change.
I like that. Melissa?
Yeah, I like that very much, because I think that this is a very deep topic with a lot of considerations, and we're really talking about is preserving year-round rental availability. And so I would make a motion to, there's so many windows with language open, to adopt Tucker's recommendation, explore incentives that encourage homeowners who rent their secondary dwelling seasonally to instead rent them on a year-round basis, and have that replace the fourth goal under our housing strategic focus area of the strategic plan.
Second that.
Thank you. All those in favor by roll call. Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murphy?
Aye.
Don Holgate, aye. Was there, I don't think that there was anything else that we wanted to change.
I don't think so.
So are we ready to adopt the strategic plan?
So moved.
Second.
All those in favor by roll call. Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murphy?
Aye.
Don Holgate, aye. Thank you. Committee reports. Anything tonight? Okay. Is there a motion to adjourn? It's really early.
So moved.
Second.
All those in favor by roll call. Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murphy?
Aye. Thank
Don
you.
Holgate, aye. Thanks, everyone. See you soon.